This is a CMA clinical competency practice test. This test consists of 50 questions designed to help you prepare for your clinical competency section of the medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. Which of the following measures is a normal specific gravity of urine? A. 1.000. B. 1.025. C. 1.050. D. 1.125. E. 1.275. Correct answer, B. 1.025. The normal range for specific gravity of urine is between 1.003 and 1.030. Most urine samples fall between the range of 1.010 and 1.025, making B the correct choice. The specific gravity of distilled water is 1.000 A. Specific gravity measurements above 1.030 C, D, and E exceed the normal range and may indicate severe UTI, dehydration, associated with fever or prolonged vomiting and diarrhea, congestive heart failure, adrenal dysfunction, or hepatic disease. 2. Which of the following is a disposable glass or plastic tube used for hematocrit determination? A. Microcollection tube. B. Capillary tube. C. Reagent tube. D. Serum separator tube. E. Evacuated glass tube. Correct answer, B. Capillary tube. Capillary or micropipettes are small glass or plastic tubes designed to hold a measured amount of blood. These tubes are used primarily for hematocrit determination. The tube is placed at the edge of the blood droplet and fills through capillary action. Microcollection A or microtainer tubes are small plastic tubes that have a wider opening that allows blood to flow quickly into the tube. These tubes have different colored tops that correspond to the additives they contain. Reagent tubes, C, are used by chemists to handle chemicals. They are not used in the medical office. Serum separator tubes, D, are tubes employed in the vacuum method of venipuncture. Evacuated glass tubes, E, are used for venipuncture if a large sample of blood is needed. 3. Which route of temperature assessment is least invasive? A. Intranasal. B. Oral. C. Rectal. D. Temporal. E. Tympanic. Correct answer, D. Temporal. In the temporal route of temperature assessment, the thermometer remains outside the body. It is rubbed across the forehead from temporal artery to read the infrared heat emanating from the patient's head. All the other routes of temperature assessment involve inserting the thermometer into the patient's body, via the nose, A, mouth, B, rectum, C, or ear cavity, also called the tympanum, E. 4. The ratio for making a disinfectant from bleach and water is A. 1:5. B. 1:10. C. 1:20. D. 10:1. E. 1:100. Correct answer, B. 1:10. Bleach and water mixed in a 1:10 solution makes a cheap and very effective disinfectant solution. 5. To screen for hearing acuity or bone conduction of sound, the medical assistant would use A/N. A. Otoscope. B. Ophthalmoscope. C. Tuning fork. D. Snellen test. E. Reflex hammer. Correct answer, C. Tuning fork. The tuning fork is used to screen for hearing acuity and bone conduction of sound, and results can lead to further testing for the patient. The tuning fork is struck on the palm of the hand of the practitioner, which causes it to vibrate. The tuning fork emits a low-frequency sound and vibration that can be felt and heard by the patient. An otoscope A is used to examine the inside of the ear canal. The ophthalmoscope, B, is used to look at the structure of the eye. The Snellen test, D, measures visual acuity. The reflex hammer, E, is used for neurological testing of reflexes. 6. Which of the following is not considered proper patient instruction for obtaining a clean catch midstream urine specimen? A. Have the patient remove undergarments. B. Make sure not to touch the inside of the container. C. Continue to hold the labia apart and void a small amount into the toilet. D. Clean the urinary meatus from back to front. E. The specimen container should not touch any part of the body. Correct answer, D. Clean the urinary meatus from back to front. When performing the CCMS or mid-void specimen collection, females should clean the urinary meatus from front to back to avoid contaminating the area. The most common urinary contaminant is E. coli from the anal opening. Students often misread this choice. Removing the undergarments, A, allows for freedom of movement and accessibility of the area. The patient should not touch the inside of the container, B, to avoid contamination of the specimen. Female patients should continue to hold the labia apart, C, ensuring that the cleansed area does not become contaminated during urination. Touching the specimen container, E, leads to contamination and erroneous test results. 7. Upon discovering a known diabetic patient who is disoriented and confused, which of the following should the medical assistant do first? A. Check the vital signs. B. Give a form of glucose to the patient. C. Draw a blood glucose. D. Check for spontaneous respirations. E. Ask what symptoms the patient is having. Correct answer, B. Give a form of glucose to the patient. You should suspect a problem with the patient's blood glucose. By giving a form of glucose, you may fix the immediate problem. Even if the blood glucose is high, it will not do any damage, and if the blood glucose is low, the patient will improve. Once glucose is given, you should immediately draw a blood sugar, C. This will confirm the blood sugar. It would not be appropriate to spend time questioning a patient who is confused and disoriented, E. The vital signs would be checked after these steps would be taken, A. If the patient is conscious, it would not be appropriate to check for respirations, D. 8. A procedure that a medical assistant would not expect to take part in when doing minor surgeries in the office is A. Suture of lacerations. B. Biopsy of the lung. C. Cyst removal. D. Biopsy of a skin lesion. E. Incision and drainage of a wound. Correct answer, B. Biopsy of the lung. You would not expect to do a lung biopsy in the office as a minor procedure. Minor procedures are done for superficial lesions, D. Cyst removal, C. Suture of lacerations, A. And incision and drainage of superficial wounds, E. These procedures have little chance of major complications. 9. Heart sounds that are heard when the blood pressure is being measured are called the A. Korotkoff sounds. B. Urine sounds. C. Snellen sounds. D. Ishihara sounds. E. Jaeger sounds. Correct answer, Korotkoff sounds. The sounds that are heard when the blood pressure is being auscultated using a stethoscope and a sphygmomanometer are called the Korotkoff sounds. Urine, B, is the name of a test of hearing. The Snellen, C, Jaeger, E, and Ishihara, D, tests are all names of eye exams. 10. The popliteal pulse is located A. On the thumb side of the wrist. B. Behind the knee. C. On the dorsal surface of the foot. D. At the apex of the heart. E. At the inner aspect of the leg and the groin. Correct answer, B. Behind the knee. The popliteal pulse is located behind the knee and most easily located by bending the knee and palpating in the crease behind the knee joint. The radial pulse is located on the thumb side of the wrist, A. The dorsalis pedis is located on the dorsal surface of the foot, C. The apical pulse is located at the apex of the heart, D. The femoral pulse is located in the inner aspect of the leg at the groin, E. 11. The most important thing to do to prevent transfer of infectious material is A. Use biohazard bags. B. Dispose of sharps in a rigid container. C. Wash your hands. D. Disinfect patient care equipment between uses. E. Wear gloves when exposed to body fluids. Correct answer, C. Wash your hands. While all of these things are important, hand washing is the single most effective thing that you can do to prevent the spread of infectious material. Hand washing can be accomplished with soap and water or with an alcohol-based hand sanitizer. Good hand wash practices will prevent the spread of pathogens between patients. 12. Which of the following types of urine specimen contains the greatest concentration of dissolved substances? A. Random. B. First voided morning. C. Clean catch midstream. D. 24-hour. E. Second voided. Correct answer, B. First voided morning. First voided morning urine specimens contain the greatest concentration of certain substances. This specimen is utilized for pregnancy testing, nitrite and protein determination, bacterial culture, and microscopic examination. Most urinalysis is performed on freshly voided random urine samples collected in clean containers. A clean catch midstream specimen, C, may be collected if a bacterial infection is suspected. An untainted specimen is needed for urine culture. The only other method of collection for a non-contaminated specimen is through catheterization. A 24-hour specimen, D, is utilized for quantitative chemical analysis such as hormone levels. Second voided specimens, E, are usually collected to test for glucose levels. 13. When moving a heavy object, one should A. Bend from the waist to lift the object. B. Ask for help if an attempt to lift the object shows that it is too heavy. C. Make sure that the object is at least 5 inches away from the body. D. Assess the object prior to trying to lift it and ask for help if needed. E. Lift heavy objects only if they are stored at waist level or higher. Correct answer, D. Assess the object prior to trying to lift it and ask for help if needed. The object should be assessed prior to the lift so you have a plan and can ask for help if you are unable to lift it alone. You should not try to lift an object if you have any doubts about its size or your ability. B. You should always bend at the knees, A, and keep the back straight with the load close to the body, C. Never lift a heavy object that is located above your base of support, E. It is always better to ask for assistance or use assistive equipment to prevent injury to yourself. 14. When removing paper that is soiled with biohazardous waste from the exam table, the medical assistant should do which of the following before cleaning the table with disinfectant and pulling down unused paper? A. Use sterile gloves. B. Roll the paper inward and toward the body working from the end of the exam table. C. Gather the soiled paper in gloved hands and discard. D. Using unsterile gloves, roll the paper down toward the body and discard. E. Roll the paper inward and away from the body, discard, and change gloves. Correct answer, E. Roll the paper inward and away from the body, discard, and change gloves. The soiled paper should be gathered inward and away from clothing to prevent contamination of clothing. The exam table must be cleaned with disinfectant prior to pulling down the unused paper. Gloves should be changed between cleaning the table and pulling down the unused paper to prevent recontamination of the clean area. 15. In an infant, you should check the pulse in which of the following arteries in an emergency situation? A. Carotid. B. Radial. C. Brachial. D. Femoral. E. Temporal. Correct answer, C. Brachial. The brachial artery is the preferred pulse site in the infant. If circulation is limited, the peripheral pulses such as the radial, B, or temporal, E, may not be palpable. The body fat composition of the infant may make it difficult to find the carotid, A, and femoral, D, pulses. The brachial artery is easily accessible as it is located in the inner aspect of the upper arm. 16. The generic name for Lipitor is A. Atenolol, B. Atorvastatin calcium, C. Clopidogrel bisulfate, D. Furosemide, E. Amlodipine. Correct answer, B. Atorvastatin calcium. Lipitor's generic name is atorvastatin calcium. Atenolol, A, is the generic for tenormin. Plavix is the trade name for clopidogrel bisulfate, C, and furosemide, D, is the generic for Lasix. Amlodipine, E, is the generic name for Norvasc. 17. After a patient has had a grand mal seizure, one would expect the patient to be A. Confused and drowsy, B. Excited and hyperactive, C. Hypotensive with a decreased pulse, D. In need of airway management, E. Needing immediate transport to the hospital. Correct answer, confused and drowsy. It is normal for a person to be confused and very drowsy after a seizure. Such a patient would not be excited and hyperactive, B. Usually there is no problem with the airway, D, after the seizure unless the patient has vomited. If this occurs, rolling the patient to the side will usually take care of this. You would expect the pulse rate and blood pressure to be elevated, C, due to the muscle activity. Immediate transfer to the hospital, E, should not be necessary unless the patient has never had a seizure, has repeated seizures, or does not regain consciousness. 18. The most appropriate position for a patient with respiratory problems is A. Trendelenburg, B. Fowler's, C. Lithotomy, D. Dorsal recumbent, E. Prone. Correct answer, B. Fowler's. Fowler's position is sitting upright and is the most appropriate for patients who have respiratory problems. Trendelenburg position, A, has the head lower than the rest of the body and is used most frequently for hypotension or shock. Lithotomy position, C, is used for vaginal examination. Dorsal recumbent, D, is lying on the back with legs bent and up on the same level as the body. Prone, E, is lying flat on the abdomen. 19. Which of the following is not a normal vein for phlebotomy? A. Cubital vein, B. Brachial vein, C. Hepatic vein, D. Cephalic vein, E. Basilic vein. Correct answer, C. Hepatic vein. The hepatic vein is a large, deep vessel responsible for draining the digestive tract and liver. The median cubital vein, A, is the most common vein utilized for venipuncture. This vessel serves as a connection between the cephalic and the basilic veins and is less likely to roll. The brachial vein, B, is located on the medial aspect of the upper arm and may be utilized for venipuncture. The cephalic vein, D, is located on the lateral aspect of the arm and is a good choice for phlebotomy. The basilic vein, E, extends from the median basilic vein up the inside of the arm. This vessel tends to roll and the medical assistant must anchor it well. 20. Which of the following situations would be of least concern when involved in a sterile procedure? A. Talking over the sterile field, B. Loose, uncovered hair on a member of the sterile team, C. A non-sterile person entering the room, D. Adding non-sterile items to the sterile field, E. A tear in the glove of a member of the sterile team. Correct answer, C. A non-sterile person entering the room. A non-sterile person who enters the room but does not approach the sterile field will not interfere with the sterile field in a minor procedure. Members of the sterile team should have their hair pulled back, B, and should avoid talking over the sterile field. A. Once a non-sterile item is added to the field is considered contaminated. D. A torn glove on a member of the sterile team, E, must be changed immediately in order to prevent contamination of the sterile field. 21. Draping is done primarily for A. Convenience of the doctor. B. Keeping the patient warm. C. Patient privacy. D. Convenience of the medical assistant. E. Facilitating the specific exam. Correct answer, C. Patient privacy. The primary function of draping is to preserve the privacy and dignity of the patient. Draping is done differently for different exams, but the patient should be adequately covered no matter what the position is. Draping material may be helpful in keeping the undressed patient comfortable, but if the patient is cold, the room temperature should be adjusted. While convenience of the medical staff is important, A and D, it is not the primary reason for draping. 22. To take the blood pressure correctly, the medical assistant should A. Use any blood pressure cuff that is available as long as it fits the patient's arm. B. Have the arm at or near the level of the heart. C. Pump up the cuff until the pulse is no longer audible. D. Release the air from the cuff rapidly in order to decrease patient discomfort. E. Position the cuff so that the artery marker is at the level of the elbow. Correct answer, B. Have the arm at or near the level of the heart. The correct level for the arm tested for blood pressure is at or near heart level. The cuff must be the correct size, A, to fit the patient's arm. Markings on the cuff indicate minimum and maximum arm size. If the fit is not correct, you will not receive an accurate reading. Normally you cannot hear pulse, C, or any other sound when the stethoscope is placed on the brachial artery. The air should be released slowly, not rapidly, D, so you do not miss the beginning sounds. The cuff should be positioned so that the artery marking is at the brachial artery, not the elbow, E. 23. A person who has difficulty breathing and experiences swelling of the respiratory tract following a bee sting may have A. A myocardial infarction. B. Anaphylactic shock. C. Obstructive airway disease. D. Cardiogenic shock. E. An asthma attack. Correct answer, B. Anaphylactic shock. Anaphylactic shock is due to a severe allergic reaction and a massive immune response by the body. It causes difficulty breathing and swelling of the respiratory tract. There can also be cardiovascular symptoms such as hypotension and cardiovascular collapse. It can be fatal. An asthma attack, E, will cause difficulty breathing but is a chronic condition usually controlled by medication. Cardiogenic shock, D, is caused by inability of the cardiac system to pump enough blood to supply the body and does not cause swelling of the respiratory system. A myocardial infarction, A, is a heart attack. Obstructive airway disease, C, is a chronic condition of the respiratory system. 24. Which of the following is not a true statement regarding tuberculin testing? A. A small amount of tubercle bacillus is administered intradermally. B. The results are read in 48 to 72 hours. C. Induration is a positive indicator of disease. D. A person who has been vaccinated with BCG will test positive. E. Follow-up testing for a positive test includes chest X-ray. Correct answer, C. Induration is a positive indicator of disease. Induration is an indication of TB exposure but not necessarily disease. Follow-up testing is necessary for diagnosis. The other four choices, A, B, D, and E, are all true statements regarding tuberculin testing. 25. Which one of the following is not a proper procedure for performing the Multistix 10 reagent strip test? A. Immediately recap the testing strip bottle. B. Do not touch the strip with your fingers. C. Hold the strip in a vertical position. D. Completely immerse the strip in the specimen. E. Discolored strips should be discarded. Correct answer, C. Hold the strip in a vertical position. The reagent strips should be held horizontally to avoid chemical reagents from each testing pad from mixing. This may cause aberrant color changes and give questionable results. Holding the testing strips vertically will also allow urine to drip onto the medical assistant's hand. Recapping the testing strip bottle quickly, A. helps preserve the integrity of the testing strips. The testing strips are sensitive to light, heat, and moisture. Touching the testing of the strips with your fingers, B. may influence the effectiveness of the chemical reagents, giving false results. The testing strips need complete immersion into the urine sample, D. Discolored strips should be discarded, E. Multistix strip results are determined by assessing color changes to the reagent pads when in contact with urine. 26. Which type of thermometer should not be used in the medical office? A. Digital. B. Disposable. C. Glass. D. Infrared. E. Tympanic. Correct answer, C. Glass. In accordance with OSHA guidelines, glass thermometers are no longer used in the medical office. Glass thermometers pose the risk of breakage. They must also be disinfected between patients. Digital, A, and infrared, D, thermometers are frequently used. A new, disposable probe cover is placed on the thermometer before each use to avoid the spread of pathogens. A tympanic thermometer, E, is a type of digital thermometer. Disposable thermometers, B, measure temperature using heat-sensitive materials. Since these degrade over time, expiration dates must be checked to ensure an accurate reading. 27. Which of the following instruments would not be needed when preparing for a cyst removal? A. Scalpel. B. Needle holder. C. Sen retractor. D. Dressing forceps. E. Speculum. Correct answer, A. Speculum. Ordinarily a speculum would not be needed for a simple cyst removal. The scalpel, A, would be used to cut the skin. The Sen retractor, C, would be used to pull the skin back after the incision is made. The needle holder, B, would be used to suture the incision after the surgery is done, and the dressing forceps, D, would be used to apply the dressing after the procedure is done. 28. To encourage an elderly patient to give information while taking the patient history, the medical assistant should A. Ask questions that can be answered with yes or no answers. B. Interview a family member instead of the patient. C. Speak loudly because the patient is likely to be hard of hearing. D. Inform the patient in the beginning that there is only a short time to perform this history. E. Ask open-ended questions. Correct answer, E. Ask open-ended questions. By asking open-ended questions, you allow the patient to answer fully and you may get more information that will in turn make the interview go more quickly. Yes and no answers, A, will not allow the patient to answer fully. Not all elderly are hard of hearing, C, nor do they need family to answer questions for them, B. This can offend the patient, which will affect the amount of information that you get from them. If you appear to be in a hurry, D, the patient may not offer important information. 29. Urine or serum pregnancy tests are utilized to detect the presence of which of the following? A. Antidiuretic hormone, ADH. B. Human growth hormone, HGH. C. Heterophile antibody. D. Human chorionic gonadotropin hormone, HCG. E. Phenylketonuria. Correct answer, D. Human chorionic gonadotropin hormone, HCG. Human chorionic gonadotropin hormone, HCG, is produced by the placenta and present in the urine during pregnancy. After implantation of the fertilized egg in the uterus, the HCG levels in serum double every few days. This occurs for about 7 weeks and then begins to decline. Pregnancy tests can detect the presence of HCG as early as 1 week after implantation or 4 to 5 days before a missed menstrual period. Human growth hormone, B, is released by the anterior pituitary gland. The purpose of this hormone is to stimulate musculoskeletal growth. Antidiuretic hormone, A, is released from the posterior pituitary gland. The hormone acts to control the body's fluid balance. Heterophile antibody, C, is released into the bloodstream in a patient with infectious mononucleosis and can be detected within 6 to 10 days of illness in an individual. Phenylketonuria, E, is an inherited condition in which a baby lacks phenylalanine, an essential enzyme necessary to metabolize amino acids. 30. The correct position to place a patient who has fainted is A. Prone, B. Trendelenburg, C. Lithotomy, D. Supine, E. Fowler's. Correct answer, D. Supine. Supine is lying on the back, and patients who have fainted should be assisted to a recumbent back, lying position, D. Prone, A, is lying face downward. Trendelenburg, B, positioning places the patient's head lower than the body and raises the lower extremities. Although still used with shock to raise the blood pressure, recent evidence shows that this position does not increase cardiac output. Lithotomy position, C, is usually used for vaginal exams. Fowler's position, E, raises the head at a 90-degree angle and is used to ease respiratory problems. 31. If a medical assistant is giving a 75-pound child a dose of antibiotic using Clark's law, which of the following would be administered if the usual adult dose is 500 mg? A. 500 mg. B. 250 mg. C. 200 mg. D. 125 mg. E. 375 mg. Correct answer, B. 250 mg. The correct dosage is 250 mg. It is calculated by dividing the 75-pound weight of the child by the 150-pound weight of the adult, which would be, and then multiplying by the 500 mg dosage. 32. When performing an EKG on a patient, if the tracing is not what is expected, the first thing that should be checked is A. Placement of the electrodes, B. The status of the patient, C. Electrical interference, D. Machine settings, E. Patient movement. Correct answer, B. The status of the patient. While all of these factors could influence the tracing, the status of the patient is the first variable that should be checked to make sure that there is not a significant problem. 33. When performing a surgical hand scrub, make sure to F. Wash for 60 seconds. B. Hold fingers lower than the wrists. C. Dry hands with paper toweling. D. Hold fingers higher than the elbows. E. Dry hands before turning off the water faucet. Correct answer, D. Hold fingers higher than the elbows. For a surgical hand wash, you would hold your fingers higher than your elbows so that water runs off the elbow area instead of the hands. This is opposite of the way that you do with a medical hand wash, B. A 60-second wash, A, would be appropriate for aseptic technique, not surgical technique. You must dry your hands with a sterile towel, C. Ideally you will have foot controls for the water, but if you do not, you should turn off the water with the sterile towel after you have dried your hands and should not touch the faucet with your bare hands, E. 34. Lyme disease, if untreated, can progress into A/N. A. Viral infection. B. Contagious disease. C. Chronic infection. D. Acute infection. E. Non-pathogenic condition. Correct answer, C. Chronic infection. Lyme disease is a bacterial disease that initially causes a rash with a characteristic bull's eye and flu symptoms. If the symptoms are mild, the infection may be missed and not treated with antibiotic therapy. It then continues as a chronic infection and affects the musculoskeletal and nervous systems. 35. Initial treatment for a sprained ankle would include A. Application of a heating pad in 20-minute intervals for the first 48 hours. B. Exercise the ankle in order to prevent stiffness. C. Application of ice in 20-minute intervals for the first 48 hours. D. Massage the ankle with pain relief ointment as needed. E. Application of an air cast to the lower extremity. Correct answer: C. Application of ice in 20-minute intervals for the first 48 hours. Application of ice to the area would be the first treatment, along with rest and elevation of the ankle. Ice will decrease the circulation to the area, which will decrease bleeding into damaged tissues. The ice will also decrease pain. It should only be applied in 20-minute intervals to prevent cold injury to the tissues. Heat is applied only after 48 hours has passed after the injury. A. Exercise B. is inappropriate as it might cause further injury at the time of the injury. Massage D. would also be inappropriate at this time for the same reason. Application of an air cast E. may be appropriate after the assessment is done but not as an initial treatment. 36. Which of the following reagent strip panels would show an abnormal finding if a person is suffering from a bacterial urinary tract infection? A. Plus glucose. B. Plus nitrites. C. Plus ketones. D. Plus bilirubin. E. Plus protein. Correct answer: B. Plus nitrites. Nitrites occur in urine when bacteria convert or reduce nitrates to nitrites. A sufficient amount of incubation time in the bladder must pass for this conversion to take place. A positive reagent strip test may indicate the presence of a bacterial urinary tract infection. Escherichia coli bacterium is the most common cause of UTIs and can reduce nitrate to nitrite. Glucose, present in a urine sample would signify the body's inability to process carbohydrates. Ketones, C, are byproducts of fat metabolism in the body and include three types: beta-hydroxybutyric, acetoacetic acid, and acetone. Ketosis occurs when fat is used for energy and the muscles cannot handle the accumulation of ketones. The ketones will accrue in the body tissues and fluids. Ketonuria is observed with diabetes mellitus, low-carbohydrate diets, excessive vomiting, and starvation. Bilirubin, D, is a bile pigment not normally found in urine. Bilirubinuria is an indication of liver disease and can result from gallstones, hepatitis, and cirrhosis. Urine becomes yellow-brown or greenish and foam appears when shaken. Protein, E, should not be detected in the urine. Proteinuria is one of the first signs of renal disease. Protein excretion in high amounts can be caused by unusually high stress or strenuous exercise. 37. To palpate the pulse in an adult, the usual procedure would be to A. Listen with a stethoscope at the apex of the heart. B. Feel at the inner aspect of the thumb side of the wrist with the first two fingers. C. Use the thumb of the dominant hand to feel the temple area of the skull. D. Located between the larynx and the sternocleidomastoid muscle in the side of the neck. E. Press deeply below the inguinal ligament in the groin. Correct answer: B. Feel at the inner aspect of the thumb side of the wrist with the first two fingers. Palpation is using the fingers to feel the pulse. Usually the radial artery is used in the adult patient for a routine pulse rate. A stethoscope, A, would be used in a young child or infant. The temporal pulse is located in the temporal area of the skull, C. The carotid pulse is located in the side of the neck and usually used in emergencies and to evaluate the effectiveness of CPR, D. The femoral pulse is located in the groin, E. 38. To have a method of checking to see if an autoclaved item is sterile, the medical assistant should A. Place indicator strips in the packs and envelopes and use autoclave tape to secure the packs. B. Set the timer on the autoclave to run for 30 minutes to ensure that the items are sterilized. C. Open one pack and check the indicator strip for sterilization after each autoclave batch is run. D. Leave an open flap in the packs to view the indicator strip to ensure that it is sterile. E. Open the autoclave prior to the drying cycle to view the indicators and tape and confirm that the item is sterile. Correct answer. Place indicator strips in the packs and envelopes and use autoclave tape to secure the packs. By placing the indicator strips in the bags and packs and using autoclave tape to secure packs, the medical assistant will be able to make sure that the instruments are sterile and ready to use in a sterile procedure. It is not necessary to open a pack and check it. C. The time needed to ensure that a pack is sterile depends on the manufacturer's instructions and the material that you are sterilizing. B. It is not appropriate to leave an open area in the pack. D. You should not remove the packs from the autoclave until the drying cycle is over. E. Moisture will encourage the migration of pathogens. 39. In which of the following radiographic positions is the patient lying on their back? A. Prone. B. Supine. C. Oblique. D. Lateral. E. Posterior. Correct answer. B. Supine. Supine positioning requires the patient to lie on their back. Prone requires the patient to lie face down. Oblique C positioning has the patient at an angle to the radiogram. Lateral D imaging is taking the picture from the side of the patient. Posterior E allows the X-ray beam to penetrate the patient from back to front. 40. Which of the following values is considered a desirable cholesterol level? A. 0 mg per dl. B. 180 mg per dl. C. 230 mg per dl. D. 250 mg per dl. E. 300 mg per dl. Correct answer. B. 180 mg per dl. A level less than 200 mg per dl is desirable. Cholesterol is necessary in the body for several reasons. A level of 0 mg per dl would be detrimental to the body. Levels 200 to 239 mg/dl are considered borderline high. C. Levels of 240 mg per dl and above are considered high. D and E. 41. Using sterile instruments to perform a breast biopsy is an example of A. Surgical asepsis. B. Sterilization. C. Medical asepsis. D. Personal protective equipment. E. Sanitization. Correct answer. Surgical asepsis. Surgical asepsis is removing all organisms prior to entering the body. This is done by using sterile technique and sterile instruments in a procedure. Medical asepsis, C, is disposing of organisms after they leave the body, as in the correct disposal of biohazardous waste. Sterilization, B, is the removal of all organisms from objects, not people. Sanitization, E, is the removal of debris from objects. Personal protective equipment or PPE are items such as gloves, masks, gowns, and eye protection. D. 42. Wearing a mask, gown, and gloves when working with a patient is an example of using A. Barrier method. B. Standard procedure. C. Personal protective equipment. D. Body substance isolation. E. Surgical asepsis. Correct answer. C. Personal protective equipment. Equipment that serves as protection for healthcare workers is called personal protective equipment. This includes gowns, gloves, face masks, eye protection, shields, and hair and shoe covers. 43. Applying an elastic or ACE wrap to a sprained ankle is an example of A. Bandaging. B. Applying a dressing. C. Splinting. D. Casting. E. Treating a wound. Correct answer, bandaging. An elastic or ACE wrap is an example of bandaging. The function of bandaging in this case would be to provide even pressure and support to the ankle by applying a bandage made of elastic cloth. 44. Which one of the following is the correct angle for a needle to enter the vein for venipuncture? A. 5 degrees. B. 15 degrees. C. 30 degrees. D. 45 degrees. E. 90 degrees. Correct answer, B. 15 degrees. A 15-degree angle is optimal for placing the needle in the center of the selected vein. A 5-degree angle, A, is utilized when seating the needle during placement of a butterfly-winged infusion device. A 30-degree angle, C, is too much for venipuncture. This angle may cause the needle to go through the vein by puncturing the posterior wall, resulting in a hematoma. A 45-degree angle, D, is utilized for subcutaneous injections. A 90-degree angle, E, is utilized during an intramuscular injection. 45. Which of the following is a gram-positive cocci that grows in clusters? A. Staphylococcus aureus. B. Neisseria meningitidis. C. Mycobacterium tuberculosis. D. Escherichia coli. E. Streptococcus pneumoniae. Correct answer, Staphylococcus aureus. Staphylo is a Greek term that denotes bunch of grapes. Staphylococci are round bacteria that grow in grape-like clusters. Neisseria meningitidis, B, is a gram-negative bacterium. Mycobacterium tuberculosis, C, has a straight, curved, or branched rod shape and requires an acid-fast stain. Escherichia coli, D, is a gram-negative bacillus. Streptococcus pneumoniae, E, is a gram-positive bacterium, but this species grows in chains. 46. A scraping of the superficial layer of skin is called a slashing. A. Abrasion. B. Avulsion. C. Laceration. D. Incision. E. Contusion. Correct answer, A. Abrasion. A scraping of the superficial layer of skin is called an abrasion. An avulsion, B, is a flap of skin that is forcibly torn or separated. A laceration, C, is a jagged or irregular tear of the tissues due to trauma. An incision, D, is a clean cut with a sharp object. A contusion, E, is an injury involving bleeding into the tissues without breaking the skin. 47. When preparing the skin for a minor surgical procedure, the medical assistant should wash the skin with antiseptic soap in an up and down motion and using friction. B. Wash the skin with antiseptic soap from the inner area to the outer in a circular motion. C. Wash the skin with alcohol and air dry. D. Wash the skin with antiseptic soap after applying sterile gloves and gown. E. Wash the skin with a disinfectant solution from the inner area to the outer in a circular motion. Correct answer, B. Wash the skin with antiseptic soap from the inner area to the outer in a circular motion. You should wash the skin with an antiseptic soap in a circular motion from the inside to the outside, not going back once you have moved further out. Up and down, A, is inappropriate direction. You would not use alcohol, C, or a disinfectant solution, E, and sterile gloves, D, are not necessary for this procedure. 48. Which one of the following diseases is confirmed by a positive VDRL and RPR? A. Hepatitis. B. Mononucleosis. C. Syphilis. D. Rheumatoid arthritis. E. Systemic lupus erythematosus. Correct answer, C. Syphilis. Venereal Disease Research Laboratory, VDRL, and Rapid Plasma Regain, RPR, are both serological tests that detect syphilis. Hepatitis A detection utilizes a serological test. Mononucleosis B testing detects the heterophil antibody within 6 to 10 days of the disease. Rheumatoid arthritis, D, can be detected by testing for rheumatoid factor. Systemic lupus, E, diagnosis requires anti-nucleotide antibody. 49. If the medical assistant notices a small tear in the sterile glove during a procedure, they should A. Put a piece of sterile tape over the hole in the glove. B. Alert the physician that they are not able to assist any longer. C. Ask a coworker to put on sterile gloves and take over. D. Continue the procedure but do not pick up sterile objects with that hand. E. Step away from the procedure and replace the gloves with new ones. Correct answer: E. Step away from the procedure and replace the gloves with new ones. If a tear is noted, the assistant needs to replace the gloves. Putting tape over the tear, A, will not restore sterility. Continuing the procedure, D, is an unlikely option since most procedures require two hands. Involving a coworker, C, is unnecessary in a routine procedure. Alerting the physician, B, may not be needed if the physician is present for the procedure. 50. Which of the following statements is true? A. A spirometer is used to measure the relative humidity of exhaled air. B. The specific gravity of urine is part of the microscopic examination of urine. C. The erythrocyte sedimentation rate is a means of identifying how fast blood clots. D. Hematocrit is expressed in mm/section. E. Hemoglobin measures the oxygen carrying capacity of blood and is expressed in g/dl. Correct answer: E. Hemoglobin measures the oxygen carrying capacity of blood and is expressed in g/dl. Hemoglobin is measured by weight and is expressed in grams per deciliter, g/dl. A spirometer, A, is a device used to measure lung capacity by tracking the volume and flow of exhaled air. The specific gravity of urine, B, is part of the physical examination of urine. Erythrocyte sedimentation rate, or ESR, C, measures the time it takes for red blood cells to settle in a specimen and is expressed in millimeters per hour, mm/HR. Elevated times are associated with inflammatory processes. Hematocrit, D, is measured after centrifuging a specimen and is expressed as a percentage of red blood cells in a specimen. Normal adult hematocrit values are 36 to 55%. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.